I want to talk about cervical cancer. It's one of the most preventable cancers, but recently the United States is seeing a backslide as far as detection.
It's interesting, and we want to know why. So that's why we're bringing in Dr. Pyle Coley, our medical expert. So this seems, we know about it. We've talked about it forever. So why are we seeing this?
I don't know. I mean, as Tom said, it's one of the most preventable cancers. And what's unique about cervical cancer is it's caused by a virus, and it's a sexually transmitted disease. So it's one of the few cancers that you can actually get from sexual intercourse. So putting all that together, the fact that we're more sexually active than we've ever been, it really surprises me that we're seeing a decrease in screening in 20 to 30-year-olds, and that's why we're seeing more cancer now occurring in 30 and 40-year-old women.
Is screening the key? Because that's the start, but it's also, it seems like there are prevention techniques that even if you aren't screened, you might use.
Yes, the vaccine is highly effective. So the human papillomavirus, or the HPV virus, causes cervical cancer. And if you're sexually active and a man, there's a 90% chance in your lifetime you'll get HPV, and as a woman, an 80% chance. So when you have a vaccine that's 90% effective, especially against the highest risk strains, you're talking not just cervical cancer prevention, vaginal cancer, penile cancer, anal cancer, oral cancer, all the other cancers caused by HPV. Yet when you look at parents of adolescents, only 61% of adolescents are up to date on their HPV vaccine. So I think a huge part of this is the vaccine hesitancy. There has been some discussion, especially with RFK Jr., about this vaccine not being safe and not being a good vaccine to give to our children and sending them the wrong message. And some of that has spurred parents to not vaccinate their children. And then, of course, women don't get screened, and that's the other part of it.
Is it for adolescents only? I mean, who should be getting this?
You should generally get it early in life, Tom, before you're sexually active. Now, if you're very sexually active, you can talk to your doctor even about getting in your 20s and 30s after you've potentially been exposed. But adolescence is the best time. And I'm talking men and women, again.
Yeah, I remember the pediatrician talking to me when Tanner was 12.
Did he get it?
Yeah.
Good.
He said, listen, I know this is going to sound unusual for me
Right.
to tell you this, but you have to do this. And I said, okay.
And what we're seeing is that the women that identify as gay or bisexual, the ones that are uninsured, they're not white, the least likely to get cervical cancer screening, least likely to get cervical cancer care, and therefore most likely to die. So I think this is all a cultural phenomenon. The science is there, but people just aren't listening.
The cultural phenomenon that we may feel the effects of in the near future, certainly in the far future, if people are not finding themselves vaccinated.
Very much so. In fact, we're losing thousands of Americans every year already to cervical cancer. And I think that number is going to continue to grow if that rising generation doesn't start to embrace cancer screening in their 20s, which is when women should start having those pap smears. As soon as they're sexually active, they should start having those pap smears because chances are they've been exposed. Now, the good thing about cervical cancer is that it warns us. It takes years to turn into cancer.
Okay.
So it starts with those atypical cells on the cervix, and that's when you catch it early, you can cure it. You just, do a colposcopy and take off a little piece of the cervix. But if you leave it over 5-10 years, it'll then turn into
How will that be diagnosed, though? How would someone know that they have this?
the pap smears.
That's
so
the
you
test.
have to get that. So every 3 to 5 years as a sexually active woman, even after the age of 65, if you've had your uterus removed, you would think, okay, well, I don't have a cervix, so I don't need to get cervical cancer screening. But if you've had high-risk HPV, you can get vaginal cancer. So you may even need to get that checked. So it's important to talk to your doctor about your risk if you're sexually active or have ever been active, because this is an infection that can even manifest years later.
Yeah, and yet so often we hear about that in older generations. So yeah, it's easy. Okay, vaccine and get your screening.
Yeah, that's the problem with it, is you hear the stories. It's easy, it's preventable, take care of it.
Well, and a lot of older women say, well, I haven't had sex in 20 years, so I don't need to worry. But remember, it could have been that exposure 20 years ago that's been smoldering that may now cause risk. So talk to your doctor.
Certainly worth checking out. Dr. Coley, good to see you. Thanks as always.